We thought we were getting a break because of the COVID-19 situation that was getting more stable. We got the EVD outbreak in September. That has been keeping us on our toes for the last 3 months. And we have a team that deployed in Mubende to respond to EVD outbreak. We have the operations manager, we have the various supervisors for the 4 pillars of our response that includes risk communication, community engagement, and accountability, and also community-based surveillance. We have a supervisor for the ambulance services, a supervisor for safe and dignified burial, and a supervisor for our PMER.
And this response, as URCS, we have trained 3 teams that are supporting in community burials. More so, we have also trained the sub-county teams that we're also supervising during the burial processes. Our responses are extending to Kagadi, Chegegwa, Mubende, and Kasanda. And we have many sub-county teams that are doing the community burials with the 3 trained teams, safe and dignified qualified trained teams that are majorly handling the high-risk cases. The high-risk cases, we mean at least cases that are fitting in case definitions of Ebola virus disease. Several people have benefited, we have already many people and have dignified them. We have had safe access to the community because we do community engagement before we do our work.
Tukunganye mu mbeera eno siwe kyateranga okubeera nga tukola emikolo bwegiti mu mbeera eno naye kino kiriwo lwa nsonga.
When we go to the field, most of the cases, it's not really easy to convince those people that Ebola is real. So we have to be very careful as we are communicating to them.
Our work is different from other burial groups like the district burial teams or the hospital burial teams because for us we dignify. We don't compromise the cultural norms and we always allow the family members to participate, however, with limited precautions. We have met different challenges and different dynamics. Like the cases that we handle in communities they are really not appeasing for human beings to be in that position. For instance, if I can give an example, some bodies that we handle, they are decomposed.
Stigmatization of the community, because if the community know that you under SDB that you bury Ebola dead body, they start discriminating you.
Embeera si nnungi olw'enkuba the kind of roads zetutambuliramu when you're coming to work, some roads are too rocky, others are slippery.
As a lady who works with the SDB team, whenever we go to the society, especially male, spill words all over me, saying, how can a woman bury? Moreover, how small you are.
I can't lie, the group of our colleagues, they get traumatized from the field. Sometimes they come and they fail to eat because of the condition they've been in. However, we go through the psychosocial support team and then they recover back.
Obubonero obusooka bwe tusooka basomesa omuntu aba alina omusujja ogw'amaanyi, omutwe ogw'amaanyi n'okuwulira obunafu mu mubiri n'okusesema n'okuddukana ke kabonero akalaga nti omuntu alina Ebola, era tuba tubakubiriza obutasemberera mulwadde oyo, baba balina okukubira gwe kikwatako n'akima ne tukima omulwadde oyo.
Some of them accept that Ebola is real, others are not accepting that Ebola is political.
When you see me, whenever I get time going to the field, to interface with these volunteers, the key reason is that they are putting their lives on the line. Talk of Ebola, talk of COVID, the way they're exposed. And we have ensured that all that it takes to protect them is in place. The PPEs, the SOPs that they must follow in order to make sure that they are not in harm's way. So far, God is still on our side, but also God helps those who help themselves. The measures we have put in place, at least so far, all our volunteers are safe amidst all these difficult operations they are in. These volunteers, these members, these staff, because they are not working alone, these staff who are frontline workers, who wake up to make a difference, to reach out to that person who is already sick to be evacuated, to wake up, to make sure that the family is safe from the person who has died, to make sure that people protect themselves. We don't create a big crisis in the country because of these pandemics. Our heroes, and I can repeat, they are our heroes, and you make the Red Cross what it is.
For now, as we speak, the situation is stable, but our teams are still on ground, on standby, still supporting the districts. Like we've always said, Red Cross, we are always the first to respond, and we will always be the last. Actually, we don't even leave those communities where we respond, because we have volunteers that stay in those communities, and they continue to support their communities to recover from epidemics. So I do appreciate that team that has been on the ground, all the volunteers, all the staff, all the NDRTs, but also I can't forget to appreciate our partners who have made this possible, because we got a lot of support from our movement partners led by the International Federation of the Red Cross and the Red Crescent, and all the other movement partners who are in country. We really appreciate them. We also have other partners who came in to support us, like the USAID, we have UNICEF, we have the World Food Program, we have ECHO. So we appreciate all of them. And then, of course, Ministry of Health, that has always guided us and walked the journey with us, especially in emergency response using the ambulance services. So we appreciate that so much. Then, of course, the HQ team, we have the senior management team who were the Ebola task force, the ones who were doing the strategic thinking and planning for the response, plus also mobilizing the resources. I do appreciate them a lot.